Hello and welcome to another episode of the Retire Wise podcast. My name is David Costner with Retirement Living Associates. Retire Wise is a partnership of Retirement Living Associates and Retirement Resource Guide. And today we're very pleased to be joined by, all right, you're going to tell me.
Eneida Agolli.
Eneida Agolli, who is a doctor of audiology here in Greensboro, just near Wesley Long. And so that's right. I haven't been here in this area in a long time, but many years ago was doing some work with Wesley Long, and happy to be in a familiar setting at least. So today we want to talk about hearing.
Correct.
And we're going to talk about how it impacts folks as they age. I know personally, as I have aged, my hearing has changed. We'll say changed to begin with. My wife might use different words as the pillows come flying across the room and say, "Why are you not listening to me?" Which may or not have anything to do with my hearing,
right?
But it may have more to do with the relationship. But that's a whole other topic.
We call it selective hearing.
Selective hearing. That's a professional thing.
That's the professional
All right,
name
that's
for
good.
it.
It's in the textbooks.
Yes, yes.
Well, good. So talk to me, if you will, about how a normal, and I know normal's the wrong word, but how people's hearing changes over the course of their lifetime, typically.
Absolutely. So what I'd like to tell patients is that it's normal to have abnormal hearing as you age, okay? There's different factors that can affect your hearing loss. Aging is the number one factor. Noise exposure is another very important factor, very important these days with the younger generation having headphones and headphones and earphones and playing music at a loud volume. All those things can affect your hearing, can damage your hearing. Noise exposure causes permanent hearing loss. It doesn't matter if it happened 40 years ago. You could have been 18 years old when you were, in a loud concert or some explosions or hunting or things of that nature. They would cause loss that's there for the years to come. However, the vast majority of people notice hearing loss as they grow older, and that makes sense. You can have the compounding factor of aging and the noise exposure, or the fact just as we grow older, the brain, of course, is not working. It's not as active as it used to be. So there's different also medical conditions that could cause hearing loss. Diabetes is one of them. As we know, in this day and age, diabetes is quite more. The numbers of people with diabetes are much higher than they used to be. Diabetes does affect your hearing significantly. There's other certain chemotherapy cocktails that could affect your hearing. There's more research showing that sometimes going under general anesthesia could affect you, not just your cognitive health, but also your hearing. So there's so many things that people really don't know or think about that could be a factor.
You mentioned chemotherapy as medications, but are there other medications?
There are other medications, absolutely. There's certain medications, antibiotics, certain antibiotics, it's the stronger ones, that could affect it. There's other medications out there some medications that people take for mental health that could affect your hearing as well, or increase your chances of tinnitus. Tinnitus is kind of a ringing, hissing, buzzing in the sounds that usually related to hearing loss, and we can talk about that further as well. But those are things that generally affect hearing. What happens though as people grow older, and generally the nature of hearing loss is tends to be very insidious. People don't really wake up one morning and say, "Oh, I have hearing loss." Right. It's something that happens over the years. And what our brain does, thankfully, is it compensates for that, right? So when you can hear well, you lean in. When you have one better ear than the other, you lean in that way. So for me, for example, because I've been doing this for so long, I've been doing this for 15 years across 3 states. I've seen thousands of people with hearing loss. I've helped thousands of people to hear better. I can kind of meet patients at the waiting area, and I kind of know right away if they have hearing loss, if they have a better ear, and just the body language of somebody with hearing loss. It's always trying to compensate.
Right.
These are patients that will read your lips. These are patients
just
that
automatically,
absolutely,
you'll see them staring at you.
Right, I will turn around to my computer and they're like, huh? And they're leaning.
Yeah.
So that's what happens with hearing loss. It's not something that generally you notice yourself until it gets to that point that you notice. It's mostly the way we hear here and we see every day is the family members, like you were saying about your wife, right? I also do a lot of marriage counseling.
No, apparently.
Of course.
Yeah, you have to.
And I don't have any certificate on that, but I have two certifications. So it's usually the other people that notice it, generally the people with less hearing loss. So patients will say, my wife complains that the TV is too loud, and my kids tell me, Dad or Mom, you can't hear us. And then you have the background noise situation. Most people with hearing loss will notice that. That's the first sign.
First thing.
They're like, you put me in a cocktail hour, in a restaurant, Thanksgiving dinner, and they're lost. So that takes a toll.
I'll give you a personal anecdote. We recently had a groundbreaking ceremony for a new retirement community that we're opening. And after the ceremony, we had a lunch, and it was under a big tent, and it was in June, so it was very hot. So we had fans, and we had lots of noise. And I was at the microphone speaking to the 200 people that were assembled there, and someone was at the front table trying to tell me something. And you actually see on the video me leaving the microphone, going over to the table, and leaning in like this. Now, that might have been a severe situation, a lot of noise.
Correct, extreme.
But I will say that in other crowded, noisy situations, a restaurant, I can remember going to a Spanish tapas restaurant recently, high ceilings, and just trying to listen to the other people at the table. It was difficult. So that's not uncommon that those are the kind of situations where folks would notice something initially.
Correct.
So my wife and I have made a partnership, I guess, or an agreement that we're both getting our hearing tested this year. So we haven't done it yet.
We hope you come here.
Well, thank you. Thank you.
We would love to have you.
Well, we're in Raleigh, so that would be a little more difficult.
Well, we have an office in Durham, so here we are.
All right, we'll figure that out. But we have made that promise to each other because we've noticed with each other. So that's probably a situation you'd recommend to others.
And we do recommend. We have lots of flyers here and articles, and we do recommend most people to get their first hearing test at 55.
Okay. Well,
that's
I'm late.
Correct. And that's if everything is okay, right? Get a baseline, have it there, see how you're doing, and you might be doing okay. Something can happen in the next few years that you don't anticipate health-wise, and that could kind of make things.
It's almost like what you do with your eyes, right?
Absolutely,
yeah,
100%.
You go for the first time, make sure you don't have any underlying conditions. You may not need glasses right then, but at least you've got a baseline.
Correct. And that we recommend. I have to say things have changed. As you know, in the past, hearing aids used to be big and didn't really work so well, and they had a lot of feedback. And I can hear from a lot of the older folk that kind of have that memory, and they say, oh, well, I don't want those things because they screech and people can't hear and they're ugly. There is a change in that, thankfully, right? So the stigma is becoming a little less. There's a lot more of us. Less important. There's the baby boomers, the generation.
We can't talk to each other if we can't hear.
Right. So it's becoming better in that regard, that people are becoming more and more aware of it. What has helped a lot, I think, to make people aware is kind of two things. I would say first, the pandemic, right? So everybody was wearing masks.
Yeah.
Now, what do you think happens when you put a mask on your mouth?
You can't look at lips.
You can read lips, but also masks of any kind are a filter. Speech cannot go through the way it's supposed to.
Sure.
So what happened for us during the pandemic was that a lot of people kind of came out of the woodwork. People that would have waited another 3, 4, 5 years to get checked. They're like, I'm going to work and I cannot hear. And then the patients are like, I'm going to see my doctors and I cannot hear them all of a sudden because they have masks. So that was kind of maybe one of the very few, if the only positive things out of the pandemic for kind of making people aware of, hey, let me get my ears checked because something is going on. Another thing I think that's helped a little bit and make people more aware is in the past 3-4 years, and I want to talk about this in depth, is there was a big study made done at Johns Hopkins Hospital, right? It was a longitudinal study where they kind of tried to measure how people, they had different groups, right? Like every study, because you want to compare apples to apples. So they measured people with hearing loss that was left untreated, people with hearing loss that was treated, and of course people with normal hearing.
Okay.
Trying to keep all the other factors kind of as similar as you possibly can. And they noticed, and they followed these people through the years, and they found out that people that had untreated hearing loss had much higher chances of mental decline and even dementia.
Right.
So this, for some reason, because dementia is now such a big, health issue, and it's exploded in the past few years, and of course we're still looking for cures, it made it out in the media, so a lot of people started talking about it. Family doctors started talking about it, not because it was front and center for them, but because patients were asking. This was put in the AARP magazine. This was, people are talking about this, right? They know, almost everybody knows somebody with dementia in this day and age.
Right.
And then younger people in their 50s and 60s, their parents probably had dementia. So these are people that are like, hey, well, let me see what I can do, right? We can't control dementia. It could be genetic. We don't know factors. But what we do know is that of all the risk factors for dementia, of the ones we can control, health, general health, healthy diet, reduced stress, this, that, all those other things that we kind of have some sort of control over, the absolutely most modifiable risk is hearing loss.
Right.
Now, you can avoid having hearing loss. If you're going to have it at that point, you will.
Sure.
But you can treat it with hearing devices.
Right. I can speak from personal experience and professional experience. We operate a number of communities that have memory care facilities.
Absolutely.
And it is something that folks are more aware of, and doctors are certainly more aware of, and will recommend to folks as they come in, as the care plan is being established, as they enter the community. If they have hearing loss, which is very apparent at that point, typically, and it's not being treated, it becomes difficult because of the devices and the management and the, keeping them and not losing them.
Right,
but
absolutely.
it has a tremendous impact, and I can remember a doctor explaining it to me as it related to a family member. When you can't hear, when you're not interacting with your environment, you retreat into your own self.
You withdraw.
That's
Absolutely.
right. And many people with dementia, even if it's early stage dementia, they're just withdrawn into their own mind. They could emerge from that to some degree
just by being able to hear.
Absolutely. So yeah,
Absolutely.
I've seen it both personally and professionally, and I have two sets with one of those left as a result of those experiences.
I got you. Yes.
Yeah.
So I can't stress enough that fortunately hearing loss is something that we can treat with hearing devices. It will not restore your hearing to normal, but when you have them on, from first thing that you should be doing when you wake up in the morning until you go to sleep, you get those nerve endings reactivated. So in fact, what happens, how that correlation, because I have patients ask me, but how does it really relate to dementia? Like, why does it have anything to do with it? Well, where you're trying to hear and you can't hear because your ears are not working properly, your brain, as I said before, thankfully will try to compensate. But the brain, of course, is only a limited number of resources, right?
Right.
So if you're using half of your short term of your front lobe to kind of try to look at people and try to really focus and concentrate to fill in the gaps, you're using these resources that you normally should be using for your cognition and memory and focus to do the job of the ears.
Right.
You get hearing devices on these people, the ears are now doing what they're supposed to be doing, and everything else goes back to where it is. In fact, we have MRI studies that show hearing loss literally shrinks your brain.
Wow.
Literally.
Yeah.
It does such a big damage on the brain because I tell patients it's a joke. Your ears are attached to your head for a reason.
Yeah.
You want to use them for
the
time that you're
and
up.
it fits with the research on dementia in general, which obviously demonstrates that staying active, mentally, physically active, is the best way of prolonging. In many cases, you can't offset the dementia, right?
Absolutely.
It's an ongoing process, but you can prolong the quality of life by staying active.
Absolutely. And truly, not even for dementia. Just your quality of life, your social interactions, your ability to be, in the group, in Thanksgiving dinners, in cocktail parties, in book clubs. Just the fact that you're able to actually interact and hear and stay active, that makes such a big difference. Not just for your brain, but literally for your mental health, like your depression rates and these. It's just social isolation is one of the worst things that could happen.
So changing direction just slightly. We've talked about some health studies and health things. You are a doctor of audiology.
Correct.
And that's not what every hearing place around has in their office, correct?
Yes, correct.
So brag on yourself and your education for a second.
For sure. I am a doctor of audiology. I've been a doctor of audiology now for 14, going to 15 years. I have an undergraduate degree from the University of Padua in Italy. And then I attended Montclair State University in New Jersey for my graduate degree in audiology. So I have overall, well, in Italy, college is 5 years because it's kind of undergrad plus a master. So I have in all about 9 years of education to be doing what I'm doing. And I've been doing it for a long time, and I can say as much as I learned in school, I learned just as much in the 14, 15 years I've been doing it. You learn every day, you learn with your patient, you learn as you go. I say it's very important. For me, the most important thing is that patients get help, right? But it's also important to get the right kind of help.
Right.
Because what I've seen for a lot of people is they've had one bad experience or two bad experiences, and they go another 7, 8, 10 years without hearing.
Right.
And they come to me and I can help them. And I do. But I'm limited on how much I can do when the brain and the ears have gone 10, 15, 20 years without any amplification, any help, any stimulation.
Right.
So it is upsetting that sometimes, people's experiences are not what they should be. We try here to kind of educate people. For me, the most important thing is that as you leave here, you have your answers, all your questions answered. What decision you make on, getting hearing aids, not getting hearing aids, that's entirely up to you.
So let's talk about probably the dirty word that keeps so many people from seeking help, and that's vanity.
Correct.
Right? People don't want ugly hearing aids, and the good news is, I think, technology has improved a lot.
Absolutely.
So that the quality of the hearing that they will experience by using the device has improved. The size, depending on budget, can shrink to very, very small or even virtually invisible.
Absolutely.
But there are those that, so the question, I guess, from all that is, have you seen a change in the vanity reasoning? Is it still there to the degree that it was, or are folks coming around to the fact that it's important for them to do, and they're doing it?
I will say the biggest factor in folks coming around is education. So I'll say I have half of my patients, maybe less, but half of them coming in and saying, well, I don't want anybody to know about it. I want it to be completely invisible. And then I tell them, well, when I make a recommendation, I might know nothing about you, how you look, what your preferences are, but I look at your hearing loss. And the number one factor for me to recommend one hearing aid versus the other is going to be the configuration of your hearing loss, the type of your hearing loss. And I tell patients, the vast majority of people have what we call a high frequency hearing loss, right? So for those kind of losses, the best type of device, scientifically, audiologically speaking, would be a device that goes behind the ear, right? So rechargeables, this goes behind, hides pretty nicely in there, this goes in the ear, kind of pretty much invisible in terms of the front. Of course, in the back, depending how much hair, less hair, women versus men,
Grow
of course.
your hair.
Right. Some people can. So you're
I have
good.
no idea what you're talking
You're
about.
good. I'll say most people, once you explain to them the why of this versus the other, they come around.
Right.
I tell patients, do I have patients that go against my recommendations? I do. Do they regret it most of the time? They do. Now, with that being said, pretty inconspicuous, goes behind the ear, rechargeable, Bluetooth compatible. I mean, it can do things that you cannot even.
Right.
I like to say to patients, this is a joke I came up with, when they ask me, well, my mom had these hearing aids that screeched and they were big, and then am I gonna, and I tell them, think of those hearing aids as a horse and carriage, and think of this hearing aid as a Tesla.
Right.
Okay, that's how far technology has come.
So Bluetooth to your phone.
To your phone, to your iPad, to your TV, I mean
Right.
anything and everything under the sun.
Right. Anything
Okay.
with a Bluetooth connection.
Correct.
That
You
has
can
sound
connect
coming
it,
out.
and that has sound coming out. You can have phone calls, you can listen to your podcast,
Yeah,
They're good for your
absolutely.
brain and for your education overall in different topics. Take your dog out for a walk. You have these guys in your ears. You have the phone in your pocket. You can listen to an audiobook, to music, to podcasts, anything and everything. I have patients that say, so what am I going to do with my AirPods now? I'm like, I'm sorry, they're obsolete. Just give them to
That's
somebody
right.
else because you don't need them anymore because
That's
you're going
right.
to be hearing much better. So that's that. There are some patients that are candidates for smaller hearing aids. We have something as small as this. This goes completely in your ear canal. No one will know about you having a hearing aid. We have these that are removable at night with batteries.
And the little tag that's on the end is not an antenna.
It
I had
is
somebody
not.
ask
It's
me
just
that.
for
That's
taking
a
it
handle.
out. A handle.
You do have to be able to get it out.
And then we have something like this. That's the only one of this
Wow.
kind. This is what we call the contact lens of the ears, but doesn't have to come out at night like contact lenses. And this stays in at about 8 to 10 to 12 weeks at a time. Usually the provider has to put it in and take it out, but you can take showers with it. You can completely invisible. No one will know. It sits close to your eardrum. Now, I will say there's a lot of contraindication for people that can get this, but it's an option. So there are options out there. That's what I want to tell anybody that's listening. The most important thing is for your brain, for your family, for everybody around you to be able to, for you to hear them, to communicate in a way that's not affecting that. And then looks-wise, as I said, there's so many options. As I say to my patients, if your friends care about you having hearing aids, but don't care about you hearing, maybe you need new friends.
There you go.
Right?
Yeah.
So.
I mean, and it seems to me, I will say that at our communities, I would say 50% or more have some sort of hearing device.
Absolutely.
So
We're living longer, which
yeah.
is a great thing, but with that comes the challenges of getting older, and hearing loss, unfortunately, is one of them.
Just part of it.
Yeah.
So what have we not covered that you'd like folks to know? Is there any other topic?
I will say vanity is an issue, and I'll say also pricing is an issue.
Right.
Right. We hear this all the time. Hearing aids are expensive, and they are. There's several reasons why hearing aids are expensive. One is the fact that they're very, very advanced. They're not like glasses.
Right.
They're not a piece of glass.
That's
they
right.
are literally computers.
Right.
There's chips inside that do 1,000 things. We're using AI now in chips. We're doing things that have not ever been imagined 10 years ago. Now we have them in our hands and we're fitting patients with it. So
Right.
that's the number one reason. Number two reason is coverage from insurance is spotty.
Right.
There is some coverage, some discounts, but really you can't just
So
walk somewhere.
some
and
Medicare Advantage plans
have discounts plans, correct.
Have some coverage for that. But
Absolutely.
Traditional Medicare, not so much.
No, traditional Medicare unfortunately doesn't touch hearing aids, but there are some plans. So cost is a concern. The good news is that if you go to the right place, there's different levels of technology, there's different budgets. So what we do here, we work with all budgets.
Okay, and since we're covering all issues, obviously recently some devices became available over the counter.
Correct.
And those are not hearing aids per se. They're
Amplifiers.
Amplifiers. They're microphones that sit on or in your ear.
Correct.
So tell me the pros and cons.
So I'll tell you an anecdote about it. When they first came out, I believe 2023, finally the FDA, 2022 or 2023, FDA finally approved them. It was 10 years in the making. They've been talking about it going back and forth, maybe even more than 10 years. And there were a lot of people in the audiology or hearing aid dispensers world that like kind of pulled their hair. Oh my God, we're going to go out of business. What are we going to do? And this and that. And I've had patients ask me, "Oh, did your business get affected, negatively by it?" Because it's also part of a business, right? You have a device. There's got to be some exchange.
Right.
Our business got better.
Right.
Because
the devices didn't work.
Right.
Right.
The
And buzzing in their
people,
ears.
correct.
Or
People
whatever.
had such high expectations.
Yeah.
And not all OTCs are bad. I'm not going to say that. Absolutely not. I'd rather somebody get some help or kind of step in that world.
Right.
And if you go 1-2 years with OTCs, that's okay with me.
Right. It's a starter.
It's a starter. It's only good, even by FDA standards, it's only good for people with mild to moderate hearing loss. It's better than nothing. It's just not what people expect.
Right.
Because they are not made that way. And most importantly, OTCs, as the name says it, you have no professional helping you set it
Right.
up. So you don't know how it was set
Comes
up.
as it
Comes as
comes.
it get it out of a box, put it in your ears, and it's as good as an AirPod, basically.
Yeah.
So that's the OTC scenario. As I said, not all bad from it. It made a lot of people aware of, hey, maybe, this is what's going on with me. Maybe I have some hearing loss. So as I said, I'm a pro for anything that puts the word
Right.
out
If
there.
it demonstrated, wow, there are things I don't like about it, but it does improve things to a degree. I now understand I've got a hearing loss.
And then they maybe take the next step and go to a professional.
Right.
Absolutely.
Right. Okay. What else? Anything we haven't covered?
I think we've covered pretty much hearing loss, what's important to do about it. If you notice it, most people would and a lot of people tell me, well, I didn't know I had a hearing loss, right? So things that you kind of want to be aware of, are you asking for repetition? Are you struggling in background noise or any time that you have a crowd? Is your TV a little louder? Is your wife or kids or family friends telling you, hey, you didn't hear me? So just kind of be aware of your communication style.
Right.
And if you feel like something is amiss, go get checked out.
Well, good. Well, thank you very much.
You are very welcome. My
It's
pleasure.
been very educational, and I'm
Absolutely.
going to go talk to my wife tonight. We're going to get an appointment to get that baseline, well,
Absolutely.
probably maybe more than a baseline at this point, but
Absolutely.
get that done. Well, thank you very much.
Well, it was a pleasure, sir. Thank you.
Thank you.
Thank you.
Thank you for joining us for this episode of Retire Wise. I think you have experienced a great education about hearing and the importance of it as we get older. I encourage you to call Dr. Agolli's office or to, if you're seeing this in another location outside of the Triad area, to find someone that is trusted in your community and get your hearing checked. Thank you again.